In this video, I'm going to talk about the cause of all chronic diseases. So if you're a scientist, you're going to say, well, all, and I'm talking about all of the non-outlier chronic diseases, which means all of these, and even when we look at viral infections. So all of these conditions are actually caused by the same underlying pro-inflammatory state, but that is generally ignored. And what do we focus on? Well, we focus on which drugs or surgery to use for these various conditions caused by lifestyle-induced chronic inflammation. So the best way to look at this is to view it as 4 layers. The outer layer is the manifestation of the disease, including bad outcomes if you get cold, flu, or coronavirus infection. Okay, so we need to understand numbers 1 through 3. Now, all of this information is found in one of the chapters in my Deflame Diet book, and you can see what I did here. Numbers 1 through 3 I left kind of like faint. You got to look at this to see what's in there, because everyone focuses on the name of their condition, which is really not that relevant, because the problem, well, the underlying cause of all of these conditions and the underlying driver of horrific viral infection outcomes is a chronic low-grade pro-inflammatory state, and it's caused by a pro-inflammatory diet and lifestyle, which I've discussed in multiple videos. So the average American gets about almost 60% of their calories from refined sugar, refined flour, and refined oils. It's horrific. And they don't exercise, stress out, and don't sleep enough. It's horrific. So it leads to massive flame. And you can see here I just kind of like increase the darkness of layers 2 and 3. There we go. And now there we go. Bigger. So, bigger and bold. So layer 2 is where the average healthcare practitioner, frankly, is terrible at. And it's no surprise because the average healthcare practitioner is taught to treat patients with their treatment procedures. All healthcare practitioners learn about this biochemistry in layer 2, but they tend to forget it. The only one that kind of makes its way into clinical world is testing for high sensitivity C-reactive protein. Otherwise, what we should be doing is embracing layer 3, which means we are going to normalize all of the markers in layer 3. Because when the markers in layer 3 are abnormal, and in most cases, the problem is an elevation of waist-hip ratio, elevation of body mass index, high hemoglobin A1C levels, glucose related, high sugar, fasting and postprandial glucose, high lipids, triglycerides. But then the other one is low HDL cholesterol. So not everything is elevated. Really, the big lipid issue is low HDL and low vitamin D. Most everything else is elevated. And the outcome is chronic inflammation. And the chemicals in number 2, as well as many more chemicals, will be chronically elevated. Over time, all of these conditions will be driven. And if you're living in a pro-inflammatory state and you get infected with COVID, your chance of dying is dramatically elevated compared to someone who has the normal flame. So what should you do? You should basically ignore the name of your condition. I know how difficult that is, but you need to do that. And you want to focus on layer number 3 and normalize all of these markers. So you can take blood pressure at home, measure your waist at home, measure your fasting and postprandial glucose at home, do your BMI at home, and do waist-hip ratio at home. You can do a lot of this at home. And if these home markers are normal, these other markers should be normal. The only one that may not be is vitamin D, which is sun-dependent. So you want to make sure you get your vitamin D level checked. So this is how you should look at chronic disease expression. It's due to a pro-inflammatory diet and lifestyle that jacks up inflammatory chemicals, that leads to elevations in measurable inflammatory markers and some lowering with low vitamin D, low HDL, otherwise everything is elevated. If they're elevated, you're more likely to get all of these various conditions that have been grayed out right now. So your focus should not be on the name of your condition, it should be on the cause. Normalizing your diet, getting your lifestyle together, and tracking your easily measured markers of inflammation. If you do that, you will likely get through life without being hospitalized, without burdening yourself with brutal medical expenses. Save yourself all of that trouble. All that trouble you can save yourself from if you normalize number 1, which normalize number 2, which normalize number 3, and then number 4 will happen at the very end of your life where you really won't care. I mean, I'm 60 now. So I'm like, at this point, I'm like, geez, I've been alive for 60 years. I got 10 to 30 years left. If I hit 80 and something besets me and I end up with cancer or something like that, I'm done, I'll just go. But I'd like to live to 80 pretty active and functional. And the only way to get there is to make sure that circle number 1 is normal. If circle number 1 is not normal, all hell will break loose and I will get one or more of these conditions and unfortunately live with multiple medications. I don't want to do that, and neither should you. If you want to learn how not to do that, you should score the D-Flame Diet book as the foundational book. All the rest are supplemental books that are focused. So if you want to learn about how to protect your joints and muscles, your musculoskeletal system, read this book. Understand how a pro-inflammatory diet is going to trash your musculoskeletal system. And of course, you can save for breast health and immune health. And of course, obviously, the Weight Loss Secrets is about how to get control of your body weight. This is my brother, 10 years younger than I am. He was unfortunate to develop cervical dystonia, and he gained 150 pounds. He went from 190 to 340. In less than 1 year, he got back to 190, and he's been that way since 2007. You want to find out how to maintain your body weight for years and years? This is the book. So single copies available at Amazon. Volume discounts are available at dflame.com, and they tend to get delivered. Well, they used to be delivered in like 7 to 10 days. Now it's longer because of the whole COVID thing. So if you like this video, here's all the social media stuff you can follow me at, and I'll see you at the next video.